My name is Bobby Chhabra. I am the Chair of Orthopedic Surgery at the University of Virginia and the President of the University Physicians Group.
What is your role specifically with UVA Athletics?
So I am the hand, wrist, elbow consultant for UVA Athletics. I have been providing care for our student athletes for almost 20 years. I'm a hand, wrist, elbow specialist, and I did my med school and residency here at UVA, but then did my fellowship in hand and upper extremity surgery, including sports surgery in San Antonio, before I returned to faculty here in 2002. My mentor is Frank McHugh. The McHugh Center is named after him. He was the team physician for almost 43 years here at UVA, and his practice was 50% sports, which was knees and shoulders, and 50% hand, wrist, elbow. And when I was in training here, he was my mentor, and he asked me to come take over his hand, wrist, elbow practice because he was going to retire, and to help care for UVA athletes, which he was doing for over 4 decades.
As we're now in basketball season, what are some of the most common injuries with basketball players?
So it really depends if it's men or women's basketball. In men's basketball, we've had hand, wrist injuries are incredibly common. They've kept me busy over the last decade. We've had injuries almost every season that involve treatment for hand and wrist. But there's injuries such as fractures in the hand. There's fractures within the carpal bones. This scaphoid fracture is one of the most common injuries in young athletes. Metacarpal fractures, which are a fracture of the hand bones. There's common overuse injuries, ligament sprains and strains, skier's thumb, which you see more in skiers, but you do see in basketball players as they fall. They'll have a ligament sprain in their thumb, and your thumb is so critical for gripping and grasp, particularly shooting a basketball, dribbling a basketball. There's also injuries in the lower extremities. There's ACL injuries, there's ankle sprains, ankle fractures. There's a whole gamut of injuries. In women's basketball, there's a much higher incidence of ACL injuries in women athletes than in men's basketball. But you have to be ready to take care of any injury. Concussion is very common in both sports too. Not as common as in soccer and football, but it does happen. So you need to have a team of individuals who have expertise in a wide area of medicine. We have a very large number of specialists who are involved with the care of UVA athletics. We have primary care physicians. We have a foot and ankle specialist. I'm the hand, wrist, and elbow specialist, shoulder specialist, knee specialist. Of course, we have our physicians who manage concussion. So it takes a team of experts to manage these high-level athletes. And or UVA Orthopedics not only cares for UVA athletes. We've been caring for UVA athletes for 70-plus years, but we also have been caring for JMU, James Madison University varsity athletes, for the last 20 years. And we care for about 10 high schools and several other smaller colleges. So many of my faculty are involved in the care of high-level athletes, but also recreational athletes. I'm at the games. I have faculty members who are on the sidelines. I go to the sidelines when I'm called and I need to go to the training room. I'm involved in basketball and football because football is a lot of injuries, as you can imagine. But yes, I'm involved and I'm at all the football and basketball games. I'm called and seeing patients in the training room if they have a specific injury to the hand, wrist, or elbow that needs a decision right away or needs evaluation. But I have sports surgeons who are on my faculty that are there managing the more common injuries, and we have a very close relationship with the athletic training staff, they are an exceptional group of people, and they are the first line. So they're evaluating these players and athletes when they get injured. They'll make decisions, and they will call the physicians to come evaluate a player if they feel that it needs, if the individual needs a higher level of of expertise in terms of making a diagnosis and making a decision regarding return to play, whether it's during that game or after injury, or whether there needs to be treatment that keeps them out, and what type of therapy. We work very closely with the trainers to determine what therapy is necessary and when we can safely return them to play.
Now, in regards to basketball, what is the hardest call to make on the court?
If there's so many injuries, is they injured their hand? Do they have a broken bone or not? Is it a sprain? Is it just a bruise? We have X-ray units within John Paul Jones Arena, of course, at Scott Stadium, so we can get those evaluations as needed. You'll often see players go to the training room for the evaluation, and they'll leave the Scott Stadium and go in. We have a tent there, but if that's for evaluation, but if they need imaging or something, we need to take them to the training room. The calls that are challenging are, there's an algorithm for concussions now. In the past, we didn't have as structured of a approach to players with concussions, and now we have an independent individual who's involved with assessing a player to make the decision of whether they're safe to return or not. There's a lot of scrutiny over concussions because of chronic traumatic encephalopathy that we've seen in football players that leads to a multitude of problems later in life. So sometimes you have to determine, is it a bruise? Is it a sprain? Can they return safely to play without aggravating it? Is it something that can be taped up like an ankle sprain? Can we tape them and let them return because they can bear weight? Or if it's so painful, did they break their ankle? Do they have a fracture, and do we need to evaluate that and get an X-ray? So often we can't make the final diagnosis and determination on the sidelines or along the basketball court. We have to take them to the training rooms for further evaluations, and sometimes we have to take them to the hospital because they have a significant injury where we don't have the imaging and the additional services we need to make some determinations.
Is there more urgency in regards to basketball players, given that the teams are so small and each individual player has a more important role on the team?
That's a very good question. I think ultimately every player is important and contributes in some way, whether it's a big team or a small team. But there's a lot of expectations now that we've won a national championship, so that comes with success. But in any sport, particularly this level of sports, injuries are common, and injuries change the outcome of games, the outcomes of seasons, and outcome of playoffs. And you need to have depth on any team because another player would need to step up into that position. So the most successful teams that will be the ones that have depth and can manage injuries to key players because they have a deep bench. I have a weekly show that's on WINA ESPN for the last 3 years. That's called Best Seat in the House Injury Report, and every Thursday I talk specifically about how injuries impact sports and how they impact the outcomes of games and how they can impact the careers of individuals. Some injuries can be career-threatening or career-ending. So it's a huge topic, and in professional sports and high-level collegiate sports, every player is important, and the teams that are most successful are the ones that have depth on the bench that can handle injuries to key positions.
You've been working with UVA Athletics for a really long time. Is there any sort of standout moments? Were you traveling with the team for Final Four and national championship?
I was in Minneapolis with the team. I'm a triple who, so I am been following UVA sports for 30 years, and that was the most amazing experience to be with the team and in the Final Four in Minneapolis, and to be in the locker room during the games and during halftime, listening to the discussions on how Coach Bennett and the players and the coaches were going to their strategy for each of the games, and then of course to be there for the celebrations afterwards was truly is an unbelievable experience that I will never forget, and was, despite following UVA sports for 30 years, that is the most memorable experience that I hope to have many more, but that was definitely the most memorable. And because I'm had to care for a lot of our players over the years, to see them recover from injuries and succeed and win a national championship was incredibly rewarding and gratifying for our whole team of physicians and trainers who work very hard behind the scenes to provide the care and make sure that our players get the best care possible, and if they're injured and have issues, that they can return safely at the right time and it doesn't jeopardize their future. And it's not just their future career in sports, but it's their future careers outside of sports. Because as a physician, we take the Hippocratic Oath, first do no harm, right? So any decision we make regarding return to play, we need to make sure that they can return safely without risk of re-injury, exacerbation of their injury, or making their injury worse where it impacts their life outside of sports.
My last question is regarding the new orthopedic facility. I know you're heading this project, is that correct?
I've been working for over 10 years now on a new musculoskeletal orthopedic facility, Ivy Mountain Musculoskeletal Center. It will consolidate all of our orthopedic specialties into one building. Right now, all our clinics, sports in one location, hand, upper extremity in one location, foot and ankle in another, joint replacement in another location. It will bring all of our specialties into one building without losing the specialty nature of the services we provide. The hand center will still be there, the sports center will be there, the joint replacement center will be there, but we will be together in a collaborative manner so we can best take care of patients. And in this facility, there will also be state-of-the-art physical therapy, occupational therapy services. There's an advanced imaging center, not only regular x-rays, but MRIs, CTs, fluoroscopy, ultrasound. There'll be a sports concussion center. There'll be our educational area for our residents and fellows. There's a clinical trials office. Our clinical trials research team will be in the clinics so that we can work with patients to provide them the most advanced care and advanced opportunities for their problems. And there'll be an outpatient OR center, particularly a joint replacement center for outpatient joint replacement. Joint replacement in the past, for even when I trained here, patients were in the hospital for several days and went to a skilled nursing facility after surgery for their recovery. Now, if you have a hip, knee, ankle, shoulder, elbow replacement, you can often go home within 23 hours. And because of the advances in the surgical techniques, the anesthesia, and even the implant technology we have, so patients can get their rehab right after surgery within the facility in our rehab center and go home. So, and a lot of our athletes will have their surgeries at this outpatient surgery center as well. But this will be one of the most advanced, or probably the most advanced, orthopedic facility in the country when it opens in the spring of 2022. I have met with our coaches, and this will be a huge opportunity for recruiting not only the best student athletes, but the best students. I think it's very important for parents of our students and student athletes to know that if their kids have injuries or problems, that they're going to get the best care possible. And I think that this facility and the fact that it's going to provide a one-stop shop type environment for the care of orthopedic injuries is really going to be a tremendous boon to not only our university, but Charlottesville, the region, the state of Virginia, and I am pretty confident that we'll be a national center of excellence when this facility opens.